This segment is sponsored by Maryland Vascular Specialists.
Well, Maryland Vascular Specialists is the premier outpatient vascular care provider dedicated exclusively to the care of artery and vein disorders related to the circulatory system. So joining us today is Dr. William T. Sue. All right, well, thanks so much for joining us here at Be More Lifestyle. So talk to us about the conditions that MVS treats.
Hi, well, Maryland Vascular Specialists treats a variety of vascular conditions. This ranges from aneurysmal disease, carotid artery blockages, and varicose vein disease, and also peripheral arterial disease, which is kind of one of the main areas that we deal with.
So what are some of the symptoms and the risk factors of peripheral arterial disease?
Okay. Well, peripheral arterial disease basically is defined as blockages in the arteries that feed the legs. So patients who are at risk for peripheral arterial disease are the same patients who are at risk for coronary artery disease or vascular disease in general in the body. So patients with family history, first and foremost, patients who smoke, have bad diets, have certain medical conditions like hypertension, diabetes, obesity, and sedentary lifestyles.
And so how is PAD diagnosed and then treated?
Well, PAD is diagnosed first with symptoms. Patients who have symptoms have typically it's a spectrum of disease. When you have mild symptoms, you have leg pain, specifically crampy calf and thigh pain that occurs when you walk. That goes away when you stop walking, to pain all the time at rest, and this can progress to foot wounds and ulcers and even gangrene. And then once the suspicion is made of peripheral arterial disease, then you get testing, which oftentimes is it's as simple as getting blood pressures in your legs, comparing to your arms to make sure they're different, or ultrasounds or then imaging to look for blockages in the arteries.
All right, now I heard you mention smoking. Any lifestyle changes that people can make to avoid vascular disease?
Yeah, the biggest lifestyle changes patients can make are, smoking, especially in patients who have a long history of smoking. But also, in addition to stopping smoking, diet certainly can help, and also exercise. Exercise can go a long way, not only in preventing vascular disease, but also in treating it. Patients oftentimes can have their symptoms get better just by exercising regularly without any kind of medications or surgery.
All right, now we're almost out of time, but before we let you go, just tell our viewers what really sets you guys apart from your competitors and where you're located.
Sure. Well, we have 14 offices all around the Baltimore area. We stretch as far out to Hagerstown, where I am, into southern Pennsylvania. And we're big enough that we can have a comprehensive workup in terms of treatment and care as an outpatient for all our patients.
All right, all the information on where they can find you available right there on the bottom of our screen. It will also be on our website. Dr. Sue, thank you so much for joining us.
All right, have a great day.
You too.